Good morning, everyone. I am Dr. Ahmed D. Abdulwahab, a diagnostic radiologist working in Rizgari Teaching Hospital in Erbil, and welcome to the daily tips uh, episode. Today, we are going to talk about a very common intracranial neoplasm, and that is meningioma. Meningioma it's a common intracranial but extra-axial neoplasm that is arising from the meninges, and there are some rests of the meningeal cells in the intracranial compartment. Uh, it's a benign tumor. The vast majority of them are benign. The vast majority are asymptomatic. Some may cause mass effect and cause symptoms related to the mass effect, especially if they are compressing some vital structures. They are more common in male. They are more common in females than males, and uh, they appear on CT scan usually as a isodense or slightly hyperdense to the brain. On the MRI, they appear as iso-intense to the brain on T1 and iso to slightly hyperintense to the brain on T2. There is usually no extension to adjacent organs, no signs of invasion, no signs of bone destruction. And on both CT and MRI, the meningiomas show intense marked post-contrast enhancement because it's a vascular tumor. And even on angiography, they show intense contrast enhancement, and some people have a funny name for it. They call it mother-in-law sign, which is the contrast comes early, leaves late, and is dense, just like your mother-in-law. So, meningiomas, about 20 to 30% of them, they show some calcification, which may vary from punctate to dense calcification. Uh, some of them will show what's called dural tail sign. We will discuss that later. Dural tail sign also can be seen in other pathologies like metastasis, so we should be careful. It's not a diagnostic sign for meningioma. Our first case today is this one. This is a CT scan with contrast, and it's showing a big midline mass that is arising from extraaxial compartment. uh, it's showing dense post-contrast enhancement and is surrounded by edema. Some of the meningiomas might be surrounded by edema, some might not, but however, the edema is usually mild compared to the tumor size. Okay, this is an olfactory groove meningioma. This might cause anosmia, or this is another kind of meningioma. This is a clivus meningioma. You can see it's located basically on the clivus. This is a T1 sagittal contrast image, and it's showing dense post-contrast enhancement. It's compressing the brainstem and the cerebellum and the fourth ventricle, and it's not invading and not extending into the adjacent organs, indicating it's a benign form of meningioma, but the mass effect might cause symptoms. This is another case of clivus meningioma. You can see it's based on the clivus, and obviously it's an extraaxial tumor that's showing dense post-contrast enhancement. This is the same kind of tumor. It's a meningioma. However, it's not in the clivus. It's a suprasellar meningioma arising from the meninges here on the suprasellar compartment and extending upward, showing dense post-contrast enhancement on this sagittal T1 weighted image with contrast. This is the same patient with the coronal image. You can see it's in the sellar meninges and extends upward. Meningioma, as we said, can be slightly hypointense or iso-intense to the brain on T1 weighted images, and iso to slightly hyperintense to the brain on T2 weighted images. You can see this is a CP angle meningioma, cerebellopontine angle meningioma, causing mass effect on the brainstem and the fourth ventricle. One of the important diagnostic considerations in CP angle meningioma is the differential diagnosis of acoustic neuroma. So is this a meningioma or an acoustic neuroma? They both have the same signal characteristics. They both show post-contrast enhancement. So how to differentiate? Usually on this T2, this is the same tumor. The CP angle meningioma. It's slightly hyperintense, surrounded by mild edema compared to the size of the tumor. Meningioma very rarely extend into the internal acoustic meatus. Usually it does not extend to the internal acoustic meatus, while acoustic neuroma commonly extend into the internal acoustic meatus. So if you see the tumor extending into the internal acoustic meatus, then more likely it is an acoustic neuroma than a meningioma. If not, it's more likely to be a meningioma than acoustic neuroma. As we said, meningioma can be isointense to the brain on or isodense on CT and isointense on MRI. So, is there anything abnormal here? Is there a tumor? Is there a mass? This is a T1 weighted image of the brain without contrast. Well, if you look carefully, you can see there is faint line here of something that we are not completely sure it's a present. So all we have to do is to go to other sequences, for example T2, to confirm. Well, obviously now it's more obvious that there is something here compressing on the brain. So giving contrast, resulting in marked intense post-contrast enhancement, confirming it's a meningioma in the posterior fossa. And you can see the dural tail sign. It's enhancement or exaggerated enhancement of the meninges adjacent to the tumor, of the meninges adjacent to the meningioma. This also can be seen in metastasis, so be careful. This is a coronal image of the same patient, and you can obviously appreciate the dural tail sign and appreciate its extra-axial location. It's not arising from the brain, from outside, compressing the brain. Another kind of meningioma is this one. This is a sphenoid wing meningioma. You can appreciate that it is arising from the sphenoid wing, from the right side. This is a T1 with contrast, okay? And you can see the dural tail sign, how the adjacent dura is enhancing. This is a calvarial meningioma. It's arising from the brain calvarium. It's in fact one of the commonest forms of meningioma, and most of them are asymptomatic unless it is large in size. And you can see it's hyper intense to the brain on this T2 weighted image. Now, where is the tumor here? Is there a tumor? Look carefully. This is a brain CT scan without contrast, okay? Well, if you go up a little bit, you can appreciate that this is the tumor and it is markedly heavily calcified. This was a calcified meningioma. However, in this case, contrast enhancement will be not beneficial since the tumor is already calcified, but MRI might help you in differentiating this kind of tumor. A rare form of meningioma is a cystic meningioma. You see a cystic mass, a complex mass containing both soft tissue and cystic component. For example, in this case, you can see this is a T2 weighted image. You can see there is a big mass here. It's arising from the falx. It's based on the falx, pushing the adjacent brain parenchyma, surrounded by relatively mild edema compared to the huge size of the tumor, containing both cystic and soft tissue component. And when we give contrast, you can see the soft tissue component, the septi in the cyst, showing marked post-contrast enhancement, and you can clearly appreciate there is a falcine origin of the tumor. And this was a rare form of cystic meningioma. This is the same tumor, and you can appreciate its falcine origin. On the sagittal images, it looks like that, but there is no signs of brain invasion or bone destruction or things like that. So, where is the tumor here? This is a brain CT scan without contrast. Is there a tumor? Well, if you look carefully, you can appreciate that there is some abnormal density, slightly, minimally hyperdense to the brain here. And when you give contrast, you can appreciate the post-contrast enhancement here, indicating it is an olfactory groove meningioma. This is located in the olfactory groove. Again, another example of calvarial meningioma. You can see it here, rising from the calvarium, pushing on the brain parenchyma. It is well defined. It is markedly densely enhancing. usually homogeneous, but some might show heterogeneous post-contrast enhancement. There is obvious dural tail sign bilaterally on both sides of the tumor. Meningiomas can be multiple, like in this case. You have a meningioma here and a meningioma here, and you can see dural tail sign here, dural tail sign here. This needs to be differentiated from metastasis. Metastasis also can be multiple and also might show some dural tail signs. Spectroscopy might help us with that, showing in meningiomas usually there is increased alanine, while in metastasis usually there is not. One of the effects of meningioma is adjacent hyperostosis of the adjacent bone. For example, in this case, you can see there is this meningioma that is it's relatively flat rather than convex. We might consider it in-plaque meningioma. And this kind of flat meningiomas, I've noticed that they are commonly causes hyperostosis of the adjacent brain bone, of the adjacent skull bone. For example, if they are in the calvarial, the adjacent parietal bone or calvarium will be thickened and even start bulging outside on the skin surface. This is not a tumor causing invasion of the bone. This is not a bone tumor. It is a meningioma with associated hyperostosis of the adjacent calvarium. So this will be our talk for today. Thank you for listening and hope to see you again in the next daily tip.